Hi everyone, my name is Amber Blackford. I'm a registered nurse at an acute care hospital, and I'm just going to give you some education about diabetes. So there are three main types of diabetes. You have diabetes type 1, diabetes type 2, and then gestational diabetes. Diabetes type 1 is what we call insulin dependent. It is when the destruction of the beta cells get destroyed in the pancreas, and it causes the patient to pretty much have to have insulin for the rest of their lives because the beta cells no longer produce it themselves. Diabetes type 1 is normally a sudden onset before the age of 30. So if a patient is not already born with diabetes type 1, then it will just happen very fast depending on if they have an illness already or if their pancreas just stops working. Diabetes type 1 patients normally have a problem with what we call DKA, which is diabetic ketoacidosis. It is when their blood sugars just skyrocket and just go super high. And normally are in like the 800, 900, sometimes higher, and can in turn possibly put them in a coma because they are not able to get their blood sugars down. Diabetes type 2 is what we call insulin resistant. So what happens there is the beta cells in the pancreas have a sensitivity or a decreased amount of insulin is secreted in the pancreas. So with that, normally diabetes can be treated. So we tell a lot of patients who have type 2 diabetes to watch what they eat, to exercise on a regular basis, and that will help manage their blood sugar. So exercise actually increases circulation in the body, which in turn will help increase insulin in the way that it is produces and circulated in the body. Diabetes type 2 is a slow progressive onset. We don't normally hear about anybody being born with type 2 diabetes. So what happens is as a patient gets older, they maybe stop taking care of themselves. We see a lot of obese patients who have diabetes type 2. So that in turn causes them bigger problems because what can happen is if you're not monitoring what you're eating, if you're not exercising, the pancreas is just going to kind of not work. It's just going to pretty much destroy itself. I have heard of some patients actually going from diabetes type 2 to diabetes type 1 because their pancreas just shuts down. Gestational diabetes is another form. So what happens with that? That is pretty much just a mom has diabetes only during pregnancy. So if they are obese, that's one issue. But sometimes you find out that your pancreas doesn't want to work during pregnancy because it's doing so much other stuff to make a human life. When a patient goes in for their 20-week glucose tolerance test, that is normally when they find out when their blood sugars are just so high when they drink that yucky, sugary syrup that they're just not able to manage their diabetes. So then they will be diagnosed with gestational diabetes. Gestational diabetes normally goes away once you have your baby, and then they monitor you for a little bit afterwards just to make sure that your pancreas goes back to normal and your beta cells are producing insulin again. With those three diabetes, us as a nurse, we always look for the 3 P's. So we look for polyuria, polydipsia, and polyphagia. So polyuria is an increased amount of urinating. Polydipsia is increased thirst. So when you find yourself, you're just drinking and drinking and you just can't stop, you just continue to feel thirsty. Or polyphagia is when they just eat and eat and they just can't stop eating. They eat all 3 meals and then snack in between. Those are 3 big lookout signs if we feel that a patient has diabetes. When a patient has had diabetes for at least 10 to 15 years, they've been diagnosed, they've been treated, or they've been treating it, we start to look for other health concerns in patients. Because if you think about it, if a blood sugar is not being managed, then other parts of the body system are probably not being managed. So there are 3 things that we look for. So we look for the macrovascular system, which involves your coronary arteries, your peripheral systems, and then your cerebral vascular system or your cerebral arteries. We look for the microvascular system, which includes your eyes and your kidneys. They're just smaller vessels. And then your neuropathic system. So this is where your nerves come into play. So with the neuropathic system, a lot of patients get neuropathy and they stop feeling things in their feet and hands, which in turn can cause a lot of sores and wounds on patients' feet. That's when we most see them. Patients will step on something, not realize that they stepped on something and now they have a hole in the bottom of their foot. They walk around some more and now it's infected. So they finally come to the hospital realizing, oh, I have a wound on my foot. It's infected, their blood sugars haven't been managed, and now, for example, we might have to amputate a toe. Being a nurse in a hospital on a med-surg unit, I have seen multiple times where we've had to amputate toes, feet, appendages, just because the blood sugar wasn't managed. When it comes to the microvascular system with the eyes and the kidneys, the eyes, you start to look for vision loss, just because the vessels, the blood sugar just doesn't circulate very well in the vessels, so they lose their vision. The kidneys, you start to see acute kidney disease, chronic kidney disease, and then in the end, patients need dialysis, all because the blood sugar wasn't managed. With the macrovascular system, you start looking at coronary artery disease, where arteries are just clogged up due to arteriosclerosis, and then the blood sugars, of course. The American Diabetes and American Diabetes Association actually lay out the types of food that they recommend that you eat. So they say that for your diet, patients need to eat 50 to 60% of carbohydrates. They should eat 20 to 30% of fats in their diet, and then 10 to 20% of protein. A lot of patients don't really know how to calculate that or keep it in those percentages. So they also lay out something called a MyPlate food guide. It is a website, so if anyone needed to go to that website and type in foods or to look at percentages, that website is very user-friendly and it's always there. I went on and I tried it out just to see what it looked like, and I definitely liked it. I could just type in my food, and it gave me a percentage for the day and what I should be eating. When you look at exercise is very important for a patient with diabetes, because what exercise does is it increases your blood sugar and it improves circulation, which then in turn, when insulin is created in your body, the circulation will help bring it all throughout your body, which will help with the neuropathy that a patient does or could end up having. They say that if a patient has never exercised before, they want a slow, gradual progression of exercise until they feel comfortable, and then turn it into a regular interval, either doing it every day or every other day to make sure they keep up with it. If exercise and diet are not really working with the diabetes, or the doctors need to include something else a little bit more helpful, they will start some oral medications. We call them oral diabetic medications. So we normally see like a metformin or Januvia typed in there. It just kind of helps the pancreas secrete a little bit more insulin, helps keep the blood sugars down for those type 2 diabetics. If a type 1 diabetic needs to be on insulin, then the doctors will help figure out how many units to give and what type of insulin, because there is multiple different types. You have like your long-acting, your short-acting, and then they'll go through the whole regimen with the patient, saying take it in the morning, take it in the evening, make sure you check your blood sugars. Diabetes is a major illness, and with lots of help from doctors, family members, it can be treated, and it can be tolerable with the patient. So it's very important to just make sure you keep up with your regular doctor visits and you ask any questions that you have, anything concerning. Any healthcare professional will be able to either point you in the right direction or help you answer your questions. I hope that this video was informative. Thank you.